Good evening, everyone. Today, myself, Dr. Jogendra Kumar Bastia. I am neurophysician, and I'm going to discuss regarding one of the most common neurological disease, which is commonly encountered by a lot of people. So, we'll discuss regarding headache, and the most commonest type of the headache is migraine. So, we'll discuss mostly regarding the migraine headache. So in this discussion, we will discuss regarding basics of headache and its type, characteristic of different type of headache, understanding migraine with facts and figures, phases of a migraine attack, signs and symptoms of migraine, causes of migraine, the common migraine triggers, lifestyle changes to prevent migraine headache, what are the medicines available for migraine, what kind of emotional support to the people suffering from this disease. Headache is a pain in any part of the head. A headache may appear as a sharp pain, a throbbing sensation, or a dull ache. Headaches can develop gradually or suddenly and may last from less than an hour to several days. Headaches are one of the most common medical complaints that we see in family practice. Most people experience them at some point in their life. They can affect anyone, regardless of age, race, or gender. There are around 150 types of headache, but the most common are sinus headache, tension headache, migraine headache, and cluster headache. You can see it affects a particular part of the head. Accordingly, they are characterized. Most common type of headache is tension type headache. It is common among adults and teens. They cause mild to moderate pain and come and go over time. They usually have no other symptoms. It is a mild type of headache, and usually people don't need medical attention. Second common headache is sinus headache. This is a deep and constant pain in the cheekbones, forehead, or on the bridges of the nose. They happen when cavities in your head, which are called sinuses, they get inflamed. The pain usually comes along with other sinus symptoms like a running nose, fullness in the ear, fever, swollen face, or some cold cough symptoms. A true sinus headache results from a sinus infection. Next is another rare but very devastating type of headache. It is called cluster headache. This is very severe. You could have intense burning or piercing pain behind or around one eye. It can be throbbing or constant. They are called cluster headaches because they tend to happen in groups, in clusters. You might get them 1 to 3 times in a day during a cluster period, which may last up to 2 weeks to 3 months. That period of the cluster headache comes for a certain days to months in a year, again subside, again it comes. Each attack may last from 15 minutes up to 3 hours. Next comes most common neurological patients who come for neurologist is migraine. Migraine headaches are often described as pounding, throbbing pain. They last for 4 hours up to 3 days. It happens 1 to 4 times in a month. It can happen any times, but usually the frequency is 1 to 4 times. The word migraine originates from the Greek word hemicranion, pain affecting one side of the head. The migraine headache tends to produce pain that usually begins and sometimes stays on one side of the head. That means it can be full head can be affected, but most of the times it happens and it starts with half of the head. A migraine headache often has a pulsating quality to it, throbbing quality, like you feel the pulse in your head. Many people also experience nausea, extreme sensitivity to light, to sound, or to both. They cannot tolerate loud sound or very bright light. Some studies have found that about 40% of migraineurs have headache pain on both sides of the head. So not just one side. And children with migraines usually have pain on both sides. And most important, not all severe headaches are migraine, nor all migraines are severe. Some facts and figures. Migraine is a very common disorder and ranks as the 8th most burdensome disease in the world and 4th most in the women. It is very common in women. Out of 5 women, 1 can be affected. It is very common. Out of 4 families, 4 homes in a village, one family might be having this problem. It is relatively less common in men. 1 out of 16 men may get it, and also little rare in children. 1 out of 11 children may have it. Migraine prevalence peaks between the age of 18 to 40, so teen to young adult age, both in men and women. But the absolute number are less in men. Migraine affects 3 times as many women as men, with this higher rate being most likely hormonally driven. The prevalence of migraine is the highest in girls after puberty and among women is between 30 to 50 years. And it usually declines in post-menopausal period, mostly after 45 to 50 years. How it happens? The phases of a migraine attack. Migraine attack has up to 4 distinct phases. Understanding the symptoms associated with each phase can help you anticipate a migraine and better manage it. 4 phases. First phase is called prodrome. It happens for hours to days. Then comes a aura. It is a short period starting from 5 minutes up to 60 minutes. Next comes the real headache. That is remains for 4 hours to 3 days, 72 hours. And following the headache, when the headache subsides, there is a post-headache period that is called postdrome. It may remain 24 to 48 hours. The prodrome, it is also called pre-headache phase. The beginning of a migraine attack, some people can sense it. Second comes aura. It is present in 1/3 of 30% of the people with migraine. All the people may not have aura. And in this phase, the progression of their migraine attack starts. Then comes the actual migraine headache. It is characterized by pain, the real throbbing, pulsating pain on one side or both sides of the head. And after the headache subsides, there is the postdrome phase, that is commonly called migraine hangover. Typically occurs after the end of the headache phase in 80% of the people. Some people remain fatigued, they actually don't feel good after this headache subsides. It may remain up to 1 day also in some patients. What are the predominant symptoms at different phases of the headache? In prodrome, in the pre-headache phase, there is irritation, depression, yawning, increased need to pass urine, food cravings, sensitivity, irritability to sounds or lights, problem in concentrating in work, study, there is muscle pain, there is fatigue, difficulty in speaking and reading, there is feeling of vomiting sensation, and some people feel sleepiness. Then comes the aura, which is present only in 1/3, 30% of the people. It may be a sudden visual disturbances, some flashes of light or some blacks, some loss of vision, some shadows in front of your eyes. It may be a hearing problem, temporary loss of sight also. Sometimes it may numbness or tingling sensation on some part of the body. Then comes the headache, which remain 4 hours to 3 days. It is a throbbing headache, sometimes drilling type of headache, sometimes ice pricking type of pain, sometimes burning. It is associated with nausea. Some people develop vomiting, giddiness, loss of sleep. Some people have nasal congestion, nasal blockage. There is anxiety, depressed mood, irritability to sound, to light, to smells. There may be sometimes the pain may spread to neck and other body parts also. There may be neck stiffness, arm stiffness, back stiffness also in some cases of the patient. And at the end, once the headache subsides, that is the post-headache phase, hangover phase. That irritability, loss of concentration continues for 1 to 2 days. That is fatigability, that depressed mood continues. Some people may become euphoric, excited after this headache phase, and lack of comprehension. In a classic headache, which is called classical headache, typical headache, it is preceded by aura. Typically consists of a strange visual feeling, zigzag lines in front of the eyes, flashing lights, occasional temporary vision loss. It may be a numbness feeling, a tingling feeling on one side of the lips, on the tongue, face, hands, or some other body parts. Only 1/3 of the migraine sufferers experience aura. Not all patients suffer from this. Fewer still with every attack. Some people with every attack they will have this aura. Sometimes there will be visual hallucinations. Some objects they see, some lights they see, some black spots they see, some blurring of vision also they can have. The migraine may be episodic attacks, comes and goes. It may be continuous headache for some days, even for months. So if it is continuous, it is called chronic migraine. If it is coming and going, it is episodic migraine. Episodic migraine, if the number of headache days in a month is less than 14 or less, and if call it is chronic migraine, the headache is happening 15 days or more than 15 days in a month and for more than 3 months. Chronic migraine patients have more significant headache with other features like osmophobia, sensitivity to light, phonophobia, sensitivity to sound, photophobia, sensitivity to light. They may have nausea, vomiting, and the head becomes severe when they move the head. So they sleep silently in their dark room. Chronic migraine affect at least 1 to 2% of the population at any point of time. What causes migraine? It is $1 million question, but actually no one knows what causes it. But it is considered, it is thought that some abnormal activities in the brain is the cause, the responsible reason. This activity can be triggered by many things, but the exact chain of events remains unclear. Most medical experts believe the attack begins in the brain, involves the nerve pathways, and certain chemicals released in the brain. These chemical compounds and hormones such as serotonin, estrogen often play a role in pain sensitivity for the migraine sufferers. The changes affect blood flow in the brain and surrounding tissue. So what causes migraine don't know, but what triggers migraine we know. There are a lot of triggers and you have to find every individual with migraine should find out them and avoid them. Most common is hormonal changes in migraine. Some people, some women during their perimenstrual period have more headaches. Weather change, very hot climate, very cold climate, there is sudden change in weather, some people may have attacks. It is related to specific foods, drinks, and food additives, especially fast food, soft drinks, and freezer food, frozen foods. Any strong odor, some people are very sensitive to smell. Any strong odor may precipitate a attack. Sleep disruption, it is the commonest cause now because most of the people, because of the lifestyle, not able to sleep properly. That is the commonest trigger now for precipitation of migraine. Dehydration, you are not eating, drinking properly and exhausted, that can cause birth control pills. Young females in reproductive age, married females, they use birth control pills. That is also a precipitating migraine triggering agent. Because of stress, because of anxiety, sometimes you are exhausted because of heavy physical exertion activity, you may have this migraine attack. And bright light, you travel in the sun, exposure to very flickering light or bright light, that may precipitate. Sometimes loud sounds, loud music and loud sounds precipitate migraine. So what to do? You should maintain a migraine diary. Take a notebook and write down. Keep the track of pain severity. Use it out of a 0 to 10 scale, how severe pain you are getting. Note it down. Any medications you take to treat that attack, also note it down. Track the details of your migraine attacks along with any potential triggers I already told that might have been involved. Can help you pinpoint the most important triggers for you. A comprehensive migraine calendar may include when the symptoms started, when the pain, where is the pain, any other symptoms along with headache, what medications you took, how long this attack lasted. Try to pair the details about your migraine attacks with any lifestyle habits that could be the trigger. Food and drink, including missed meals or dehydration. Medications you take for other health issues. Stress, loss of sleep, exercises, excessive exercises, weather changes, menstrual cycle, your environment, like if there is some loud sound is coming, there is some light, some strong odor, all those things you note it down. Now, women and migraine, I already told it is very common in women compared to men. The reason it is more common in women, it is related to the hormonal changes. So it is common in the reproductive age between the age of 20 to 50. So during perimenopause, there is a big swing in the hormonal pattern. During the menstrual cycle, there is swing in the hormonal pattern. And this is the period where you get the severe and more frequent attacks. During pregnancy, you may have attacks which are more common during the first and second trimester. Toward the end of the pregnancy, usually most of the patients get a relief. And post-pregnancy, again it comes back. During puberty also, because of the rapid changing in hormones, during menstruation and during menopause. Lifestyle is the most common trigger for migraine. It is increasing because of our very bad lifestyle. So, lifestyle and behaviors, what is needed to prevent migraine? Sits, sleep properly, eat timely, do regular exercise, take proper healthy diet, avoid stress. So, sits is the key how you can change your behavior to control your migraine. There are a number of ways to reduce the trigger that set migraine symptoms. A simple approach is to minimize variation in your daily routine. And that is sits already I told you. Keep a sleep routine, consistent daily schedule. That not mean you are sleeping one day in the late night, other day in the mid of the day. So if your changing sleep pattern is very much detrimental to your headache attacks. Second is relaxation training. 4 out of every 5 people with migraine report stress as a trigger. By doing relaxation training, you can reduce your stress, your anxiety, and you can have benefit, you can control your migraine attacks, you can reduce your migraine attack. Daily relaxation practice can help you achieve a physical and mental state of calm and reduce migraine attacks. Diet and migraine very important. How and why people react to different food is not yet well understood. However, it is worth trying to identify if you have a food trigger and then avoid it. It is not specific for every patient. It is not generalized. One food may cause headache to one patient, but some other people it is not causing headache. So it is individualized. Byproducts of food aging and fermentation, like red wine, aged cheese, food prepared with yeast and yogurt. These are usually commonly causes migraine trigger. Food with ingredients that affect our nervous system. Coffee, the most common culprit. Chocolate, MSG, aspartame. These are preservatives used to with the frozen fruits, frozen food items. Citrus fruit. Some people develop headache after taking lemon, orange, and the citrus fruits. And the nitrates that are used as preservatives in most of the packaged food is the culprit of a headache. Sometimes that cured meats in the frozen meats also. Food you are mild silent allergies sensitive to, such as milk, corn, soya, wheat, but it is very often happens to those special people who are allergic to it. Gluten sensitivity is particularly a common issue for those with migraine. How to manage migraine? How to reduce the attack? How to relieve while we are getting a severe pain? What to do? First, to identify your individual triggers. Already told a number of things that precipitate that triggers your headache attack. You note it down, identify them, and try to avoid them. Exercise. Have a routine daily aerobic exercises, which is not only helpful for migraine, it is helpful for a lot of health issues. Proper hydration, drink adequate water, hydrate yourself. Sleep optimization. Sleep optimization means not just sleeping. Sleeping to 10 hours, 15 hours is not sleep optimization. Sleeping for adequate duration in regular period, regular time of the day, not in different times of the day. And diet optimization. Take healthy and nutritious diet. Avoid those all junk foods, nitrate preservative containing foods, soft drinks, alcohol, all those things. There are some non-pharmacological therapies like nutraceuticals, manual therapies, massaging, all those things a lot of people do at their home. Acupuncture may be helpful in some people which are very refractory and chronic pain and not respond to medical treatment. To reduce the stress, relaxation therapy, biofeedback, cognitive behavioral therapy with the help of a psychologist, you can practice all those things to reduce the stress and anxiety. That is very much helpful. Now, treatment, proper treatment. We treat in two phases. One is acute intervention. You are having a very severe headache. You have to terminate it. You have to stop it immediately. That is called active intervention. Second is preventive intervention. Preventive intervention means you are having frequent attacks 5 times, 10 times in a month, 20 times in a month. To reduce that, you have to take some medications for a longer period, which will work after taking some 2 to 3 weeks, and you have to reduce the frequent attacks, severity of the attacks, duration of the attacks. So 4 phases, 4 hands of the management. One is self-management, lifestyle intervention. Second is psychological intervention, relaxation therapy, biofeedback. Third is complementary and alternative intervention. Different types of non-pharmacological therapies are there. You can utilize them: yoga, meditation, acupuncture, manual therapy, massaging, all those things. Fourth is pharmacological interventions. Already I told acute headache relief and prevention of the further attack. Management tips for the migraine. Keys to the management of the migraine. Watch headache triggers. Find out what are the things triggering the attacks. Practice good sleep habits. Lose excessive weight. Daily exercise. Practice yoga or any other relaxation therapy. Treat a migraine early in the headache. It is very important. If you are having headache, don't wait. It becomes severe. You started vomiting. You become ill. Once you are getting the symptoms, take the medication. It will some minutes to hour. It will reduce the attack. It will stop it. And usually, if you take the medication when the headache is very severe, already progressed, the medication usually does not work so effectively. And most important is don't overuse the pain medicines. Always try to reduce the need of medications less than 3 days in a week. I think I will better 1 day in a week. Because if you overuse the medication, the headache will increase day by day, and a point will come, you will have severe headache and no medicine will work. It is called medication overuse headache, and it is a very severe kind of headache, very refractory to the treatment, and it is very difficult to come out from this type of headache. So always watch what you are eating, always watch what painkiller you are using, and don't overuse it. If appropriate, treat with preventive medications. So, to summarize, know your triggers, fit in regular exercise, eat regularly, make time to distress yourself, maintain a migraine diary, quit smoking if you are already smoking, always keep yourself properly hydrated, make sleep a priority. There are a lot of medicines for migraine. Medicine for acute treatment, they work mainly to reduce the pain immediately, short-term relief. They are available over the counter in lower doses. These drugs are often called abortive or acute migraine treatment because they stop the pain once you take it. Commonest are non-steroidal anti-inflammatory drugs. We commonly call it NSAIDs like aspirin, ibuprofen. But always better to take advice of your nearby doctor, family physician, neurologist, and use these medications because there are a lot of side effects. If you not use it properly, if you overuse it, you will have all the side effects, and these side effects will be more severe compared to your headache. Analgesics are medications that treat pain but don't reduce the inflammation. So taking the analgesic will not solve your issue. Another group of medicine called triptans. They can help relieve the dilatation of the blood vessel in your brain, in your head, which involves in migraine pain and block the pain process. They are useful when these common painkillers, analgesics, and NSAIDs does not work. Opioid analgesic drugs. These are used when these two categories, triptans or analgesics, do not work or reduce your pain immediately. Now comes the important part, role of a caregiver. Help your loved ones during a migraine attack. Those people having migraine, they are in a very bad state of emotion and mental and physical health. They need your support. So cooperate with them. Provide them a cool and dark room. They are sensitive to light, they are sensitive to sound. So give them a silent, cool, dark room and let them stay in calm and quiet. Put some ice packs, keep washed clothes, keep them hydrated, give them proper hydration, ask them or allow them to drink properly. Medicines, know where the medicines are kept, know the correct dose to give. Keep these things handy, sunglasses, earplugs, because they are sensitive to light. To avoid the bright lights, they can use sunglasses, earplugs to avoid the loud sounds, sleep masks they can use, air sickness bag, they vomit immediately. Traveling on the flight or in the train or buses, they will vomit immediately. So keep a air sickness bag ready along with backup plan, ready to change your plan to take it easy when migraine strikes. Be there for them, give them reassurance, give them moral support. Emergency contacts, keep all emergency contacts on speed dials on their phone, including doctors and close relatives. When the children are affected, it is very difficult. It is mostly the headache for the parents more than that of the children because they don't know what is happening. So you have to be more proactive in that case. Watch the signs. Pay attention to the signs of the migraine attacks. Sometimes they start with little yearning, fatigue. Inform the teacher or the adults. Help them understand what they should do when migraine hits. Keep them hydrated. Make them drink lots of juice, water. Because dehydration is a common cause of migraine precipitation, migraine trigger. Limit the screen time. That is the most important thing because nowadays everyone is stick to the mobile or computer, iPads. So that light of the mobile and iPad or computer screen is very detrimental. It precipitates, triggers the headache very badly. Don't let them watch or stare at a screen for more than 45 minutes. Put a time stopwatch and 45 minutes off it. Limit sugar intake. Sometimes some children get headache because they take lots of sugar drinks, sugar containing foods like chocolate, ice creams. That precipitate attack, but though it is not generalized, but specifically some children. Maintain a migraine diary to note the duration, number of attacks in a week, medication use, symptoms the child is having during this attack. It will be easy for your family physician or neurologist to guide you. Enough sleep. Make sure that your child gets enough sleep during the night. During the night is the most important. That's the natural sleep hours. Be there for them. Migraines can affect your children socially. Talk to them about how they feel about their illness regularly. So, take home message migraine headache is a highly prevalent disorder. Migraine affects 3 times as many women as men. Rate being most likely hormonally driven, mostly in reproductive age group. Understanding the symptoms associated with each phase of migraine attack can help you anticipate a migraine and better manage it. Tracking the details of migraine attacks along with any potential triggers that may have been involved can help identify the most important triggers of migraine. Migraine can be best managed by lifestyle modifications like maintaining a sleep routine and having a consistent meal time and daily aerobic exercise. Daily relaxation practice can help to achieve a physical and mental state of calm and reduce migraine attacks. Thank you very much.
Yeah, so Doctor, are we done with the webinar? Hello.
Yeah.
Yeah, so we'll wait for 10 to 20 seconds. If any questions attendees will post.
Okay, fine.
Yeah, so sir, with your permission, we'll conclude the session. We seen there's no questions in the chat box.